Hello everyone, my name is Dr. Chaitra. I'm an obstetrician and gynecologist from Bangalore. Today we will be talking about a condition, very common condition I'm sure most of you all would have heard about, fibroid. But what makes it interesting is we will be talking about fibroids in pregnancy. We decided to do the talk as we received a very emotional letter from a very friendly patient of ours. Well, I will be telling you what is a fibroid. I'm sure most of you already know what is a fibroid. It is kind of a growth in the uterine cavity, unwanted growth in the uterine cavity which arises from the smooth muscle tissues of the uterus. When this fibroid is situated outside the uterine cavity, it is not going to be affecting or harming the pregnancy anyway. But unfortunately, if this fibroid is going to be inside the cavity, that is when the problem arises, because it will have to share its place with the growing baby. So when it is sub-serosal, we don't have to worry. What happens now is, whenever there is a fibroid in the uterine cavity, commonly if there is a huge fibroid or there are multiple fibroid, women may present with infertility because there is no perfect or regular area for implantation. So what happens? We will be talking in three groups. Rather, I will be talking to you about what is the effect of a pregnancy on fibroid, what is the effect of the fibroid on the pregnancy in terms of on the baby as well as on the mother. Well, when talking about the effect of the pregnancy on the fibroid, well, in pregnancy, as you know, there's a lot of hormonal changes, and along with the baby, the fibroid also grows. So sometimes when the fibroid is growing and the inner part of the fibroid doesn't get enough amount of blood, then it starts degenerating. So this we call as red degeneration. How do women present with? They present with an acute pain in abdomen, and on examination there will be a little bit of tenderness. And that is very scary because tenderness is associated with many other conditions which can be life-threatening in pregnancy. Now, what is the effect of this fibroid on pregnancy? Well, in the first trimester, this fibroid, if it is situated in a place close to or somewhere around the placenta, there are very high chances of miscarriages. Along with that, if the fibroid is situated somewhere around the placenta, the growth or the blood supply to the baby may not be sufficient. So the baby may be a little restricted growth, or the growth may not be as expected. So this is the effect of this particular fibroid on pregnancy. If this, as I already told you, if it is outside, we have no effect. But if it is inside and when it has to share its place with the growing baby, that is when we see a lot of complications. So in a mother, what happens? What are the complications that we can expect? As I already said, she can have acute pain abdomen. She may have to visit the doctor more often. So in that case, what happens? We will be giving her certain painkillers, trying to reduce the pain in her and the inflammation in her. So on the baby, this fibroid sometimes doesn't behave too stubborn, may not give enough amount of place for the baby. So as you know, as months progress, the baby repositions itself to bring the head down so vaginal delivery can be facilitated. But what happens when there is a fibroid, this may not happen and the baby may not be able to take the exact cephalic position. So sometimes you may find a breech presentation where the baby's head is on top, or an oblique or a transverse line. So in that case, the requirement of a cesarean section increases. So that's the effect of the fibroid on both the mother and the child. Sometimes there is a dreaded condition which is called the abruption which can happen. That is, the placenta separates off the uterine wall, creating a very emergentic situation because the bleeding may start accumulating inside the uterus. That becomes an emergency for the mother as well as the child. So along with that, post-delivery also we may have certain complications, like the uterus may take a little time to involute, to get back to its normal size. And sometimes there may be increased chances of getting infection in the uterus. And during the delivery, also we may have certain complication which is called the postpartum hemorrhage. The uterus will not contract that easily, so loss of blood also may be a little higher. But it is not a condition that we have to get really tensed about. I am sure that we will be able to manage the condition. So if you are coming pregnant along with fibroid, please don't get worried. I'm sure we will be able to find a management. But if this fibroid is detected much earlier or before pregnancy, then yes, we can find out ways where we can remove it, rather we can excise it, or we can give certain medications which can reduce the size of it. before planning pregnancy. So make sure that you speak to your gynecologist and clear all your doubts. Again, fibroid is nothing to get worried about. Thank you.